When we train housing providers and other providers on harm reduction, three things that we like to get across. One is from Pat Denning, who was a co-writer of Practicing Harm Reduction Psychotherapy. It's a great book. And she talks about substance users, and she says, people with substance use disorders are people with problems, not problem people. And I think that that's a really nice, concise statement that gets at the stigma that's associated with people with substance use disorders, that they're difficult to work with, that they're liars. I often hear that, that you can't trust what they're saying, that they don't care about themselves or anybody else. They're thieves, they're this or that. People don't want to work with them. They've been volleyed between mental health and substance use systems for a long time. So we really try to humanize substance users and help people understand that like any other disorder, these are human beings, really creative, resourceful human beings that have some problems, not problem people. Another thing that we try and get across is that people who use drugs make healthy decisions all the time. They can and do make choices about their health that are pro-healthy, that are pro-social decisions as well. They take care of one another, particularly opioid users, really take good care of one another. For example, when somebody is dope sick and doesn't have access to the substance to get right, people often share what they do have. People take good care of one another. And so recognizing that and understanding that and affirming that in people when people are working with folks with substance use disorders, that's something that we try and get across. And then finally, that there's a lot that you can do to help people short of total radical abstinence. So something I often hear from people is, if they're not ready to stop using drugs, there's just not much we can do. So we do a substance use management training to help people understand the biopsychosocial phenomenon of drug use. So it's not just about the drug, right? It's not the presence or absence of this drug use, but there's the biological piece, there's the psychological piece, and then there's the social aspect. And people can make really tiny, subtle changes in each of these areas that can have huge impacts on their quality of life. And I find that it's really heartening for people engaged in this work because people tend to get disheartened. They tend to feel at a loss with some folks and like there isn't anything they can do. And it feels good to know, there is actually a lot I can do with this person, even when they're engaged in pretty significantly chaotic substance use patterns. We can help them unpack that. We can help them figure out little things they can do, like using a clean needle every time, like making sure somebody else is with them when they use, like going to the doctor on a regular basis, treating their abscesses, preventing their abscesses, so on and so forth. There's many tiny incremental changes that people can engage in.